Okay, so we're gonna be doing the blood transfusion demo. Once we go into the room, we're gonna introduce ourselves to the patient, verify their identity. We're gonna perform hand hygiene and put on our gloves to do our assessment on the patient. Regarding the blood transfusion, we're gonna verify that if they've ever had one, have they had any reactions to it. And we're also gonna make sure that all their consent forms are signed. We're gonna make sure that they have any questions. If they do, we will go ahead and contact the provider so that the provider can come back and explain to the patient. Once all the consents are ready, then we can begin our transfusion process. We're also gonna make sure that the type and cross matching is in. And we're gonna need our flush, alcohol wipes, saline, and our special white tubing for the transfusion. First off, we have to verify that the patient has a patent IV access. So we're gonna go to their IV port and make sure we unclamp. And then go ahead and clean the port. With our primed flush, we're gonna insert it. And then we're gonna check for blood return. Once we verify patency, we're just gonna flush. After flushing, we can go ahead and remove and secure this with a cap if it has one. In order to start our infusion, we're gonna get our saline bag and spike it and prime the tubing. We're gonna ensure that all clamps are closed before we actually hang it. So once we hang it and prime our entire tubing, we are going to once again clamp from our bottom tubing and go ahead and prime the other extension of our white tubing in preparation for our blood bag. So we'll leave that there, secured, making sure that there's no contamination of the end. Then we're gonna go ahead and take another alcohol wipe. Wipe our port and connect our infusion of saline. Set up our infusion on the machine and go ahead and unclamp and let it run so that we can keep that vein open while we go down to the blood bank to retrieve the blood. Once at the blood bank, we're gonna cross-check with the person there. We're gonna verify that it's the right type of blood type, whether it's Rh negative or positive. The name of the patient, we're gonna verify that we have their date of birth, their MR number, and their blood bank number as well, and the expiration date of the actual blood. Once we check that, we're gonna sign for it, and the blood bank tech is also gonna provide us with their signature. After we verified that it's the correct one that we need, we're gonna put it back in the biohazard bag and carry it back to the room. Our blood is good for 30 minutes, so if something happens and we don't end up using it within 30 minutes, it's no longer usable. So we need to be able to foresee and be sure that 30 minutes have not passed so that we can return it to the blood bank and they can store it safely. Once we go back to the room, we're actually gonna call another nurse to verify our blood transfusion facts with. And we're gonna go down the same list, verify against the MAR, against the doctor's orders, and then also verify all the stuff we just verified with the tech. They're gonna sign for it as well. So once we remove it from the bag, we are gonna go ahead and spike our blood. Our blood can only run up to 5 milliliters per hour for the first 15 minutes. And it's also important to, at this time, to watch the patient for any allergic reactions, since they do tend to happen in the first 15 minutes. We're gonna spike our blood. After spiking it, we're gonna fill up the chamber and make sure that the saline is locked here. And we're gonna make sure that the blood starts to run down here. So we're gonna prime our tubing with the blood. And once it gets to around here, we're gonna be sure to set up our pump for the first 5 minutes. After those, for the first 15 minutes. For the remainder of the time, we're gonna go ahead and put it up with the remainder of at the different rate for the remainder of the hour and 45 minutes. So we unclamp, we set up, and we remember to stay with the patient, making sure that they're not having any allergic reactions. After those first 15 minutes, we can go ahead and change the rate, and the blood will have to be infused over a total of 4 hours. So that's usually the routine. Afterwards and during the infusion, we have to monitor the patient, making sure that there's no allergic reactions or that the IV site isn't becoming compromised. We're gonna go ahead and document that the patient got their right blood, that we verified with the appropriate people, and also how they tolerated the procedure. And that's it for the blood transfusion.